Welcome to the Search Africa pilot project presentation. I'm doing this presentation in addition to the text part of our application, just to give more information on the problem itself, but also to provide a visual representation of the second part of the project, which is the online information portal. My name is Dion Lowe. I'm the medical coordinator for Search Africa. We're a newly formed non-profit organization with a mission of bringing sustainable energy to centers of health in Africa. The Search Africa concept was born out of conversations I had with fellow health workers and clinicians traveling to Africa to provide quality care to the local people, and the frustration many of them had in trying to do this in the face of non-existent or unreliable energy sources. One story that particularly struck me was how a pediatrician told of having to send mothers and children away from hospital because of an energy problem. The scenario was that children would be brought to the hospital with a chest infection. The doctor then identified certain cases where ventilatory support was required. He had to actually then acknowledge to the mother they cannot provide that level of care and advise them to return to the village or town they're from to essentially say their goodbyes to the family. So this was a death sentence because of an energy problem. And for the doctors, this was very, very frustrating because it's not a problem they're familiar with. So the Search Africa model was born. It has two parts to it. The first is the data generating system, and in this system we directly engage with the medical community to come up with solutions which are suitable at site level. But it also consists of an online information portal to allow for the effective transfer of knowledge between stakeholders. The problem we're dealing with can actually be divided into a root problem and the systems problem. The root problem is simply just the lack of reliable energy and the impact it has on the quality of care clinicians can provide. However, down the line, we have identified that there is a systems problem. In essence, this is just the lack of investment in healthcare infrastructure development. Part of the issue is a lack of data to plan interventions, but in addition to that, there is poor communication between stakeholders. So why is there a lack of investment? Well, unfortunately, the problem has some historic precedents. As this map shows, public health spending in Africa is simply not adequate. Equally, if you look at other forms of financing like private investments and CSR projects, the picture doesn't look much different. But I particularly want to mention crowdfunding. This is an ever-increasingly popular way of financing projects. One organization, Sunfunder, has as their focus the financing of small and medium scale solar projects in Africa. And if you look at their website, they have more than 30 projects on their website. But unfortunately, not one of those projects deal with healthcare facilities. So you've got a number of homes, quite a few businesses, and a lot of schools, but not one clinic or hospital. Thinking about it, you soon realize that for a school, there's a much simpler generic solution almost. You just need to power a few laptops and provide lighting in a few classrooms. That's pretty much it. Contrast that with the variety of clinics and healthcare facilities. So one clinic might offer an antenatal care service and want to use an ultrasound Doppler to do that. Another health facility might not need a Doppler, but they'd have a small operating theatre and they'd need efficient lighting, they'd need sterilization equipment and the likes. What I'm saying is that for healthcare facilities, you need more detailed site-level data to plan adequate interventions. But this is part of the problem. There is a lack of data. And the solution we propose is to engage with the health workers who are familiar with the site-level issues to fill the data gap. And once the information is available, you then need to make sure that stakeholders are communicating with each other in a useful way. So, for example, the doctor in the middle of that picture might identify that he needs to offer an endoscopy service in his clinic. So he wants to use an endoscope, which he knows requires a light source. He needs to be able to sterilize his equipment, and he wants to do this in a well-lit environment. Well, he might be able to come up with that narrative describing the service he wants to offer, but it has to be translated into data that is useful to the energy provider. So be it a small-scale solar developer or even a large-scale developer. And then the whole project, of course, has to be packaged into a unit that is attractive to the people who hand over the big checks. The Search Africa solution is to tackle this problem of lack of investment head-on and to attract funding to develop the healthcare sector more. To do that, we will provide data that's collected at an efficient level of cost, but this data will be of a proven quality and recognize the unique profile of site-level medical services. Once the information is there, we will process it, we will add to it, and we will make it accessible to all the important stakeholders. Now, the data generating system is dealt with a little bit more in the text part of our application, so I'll just say a word on the online information portal. And this is what we envision it might look like. This is a screenshot of the Search Africa website, and on it we will have a project map, which is an interactive map with icons on it indicating the location of the various facilities. After the pilot, which will deal with 10 facilities, we will have 10 icons. An interested person or party can then click on the icon to get more information on that selected clinic or hospital. In addition to the map format, we'll also have a project database format where each facility will be introduced in the form of a descriptive narrative which tells you a little bit about the facility and the challenges they face. In this screenshot, the narratives that I've used are completely fictional, but it gives you an idea of what it might look like. Again, an interested person can then click on the particular facility to get more information. And this is what a full data set might look like. A facility would be described in terms of its location. The building description would be relevant to, say, PV providers needing information on the structural integrity of the roof. And you'll have sets of information like energy specifications, which will include energy-dependent medical services. You'll have a section on expected impacts, which is particularly relevant to funders. And you'll have a section on logistics, and this might include building ownership, potentially a list of local contractors, and certainly information on existing funding potential, if any is available. This is a proposed set of data questions. It will be a much more informed set once we've gone through the stakeholder consultation phase in the first part of the pilot. In addition to this data set, we will also present on the platform proposed improved energy solutions, for example PV installation with better battery capacity, and we would determine an estimated cost of such a project. So where you would previously have had a facility which little is known about, you now have a full data set with challenges, specifications, and everything required to plan interventions, but also it is presented in a format which is infinitely more attractive to funders and investors. I hope you've enjoyed the presentation, and please consider funding us and getting us off the ground.